Hello everyone and welcome to my YouTube channel. The topic of today's discussion is Sick Sinus Syndrome. So Sick Sinus Syndrome is also known as sinoatrial disease or tachybrady syndrome because it causes tachycardia and bradycardia alternatively. So what happens is there is dysfunction of SA node, which is a natural pacemaker of the heart, and there will be inability to produce a normal and consistent heart rate rhythm. So there will be haphazard heart rate rhythm pattern. Although this condition is uncommon, but it is one of the topmost causes of artificial pacemaker, and it is caused by fibrosis, degenerative changes, and scarring or damage from a previous cardiac surgery, genetic mutations, certain Alzheimer's medications, inflammatory diseases, and ischemia of SA node, either from previous myocardial infarction or heart failure. It is more common in old age, and it may present with palpitation during the episodes of tachycardia and syncope during the episodes of bradycardia. So the common features of Sick Sinus Syndrome that you can appreciate on ECG include sinus bradycardia, sinus arrest, which is SA block, paroxysmal atrial tachycardia, paroxysmal atrial fibrillation, or even atrioventricular block. So calculating rate and rhythm from the ECG of Sick Sinus Syndrome is quite difficult because it keeps on changing. So it may start from bradycardia and then suddenly convert into tachycardia. Then it may show atrial fibrillation or atrial flutters or atrial tachycardia, and it may include even AV blocks. So yes, it's very difficult, and you require long-term ECG monitoring for this. And in this ECG you can see bradycardia, and in some places you can see AV nodal block as well. So sometimes ECG can even show a long pause, sinus pause. As you can see in this, it's approximately 8.5 second pause. It is a long pause. So you can see the QRS complex over the right side and the left side, and there is no another QRS complex or P wave in between. So you can clearly appreciate long pause as well as in bradycardia and some leads and atrial fibrillation as well. So these are the features of Sick Sinus Syndrome. So the signs and symptoms of Sick Sinus Syndrome include slower than normal pulse, fatigue, dizziness or lightheadedness, fainting or near fainting, shortness of breath, palpitations, chest pain, trouble sleeping, confusion, and many of these signs and symptoms are due to reduced blood supply to the brain. So it has been seen in researches that greater age and white race, as well as cardiovascular risk factor like obesity, hypertension, diabetes, and increased level of blood biomarkers like cystatin C and brain natriuretic peptide, these all can lead to Sick Sinus Syndrome. So blacks have a 40% lower risk of Sick Sinus Syndrome than whites, and they can lead to the formation of signs and symptoms of Sick Sinus Syndrome. And the ECG variables may show lower heart rate, prolonged QRS interval, right bundle branch block. So the emergency treatment may involve oxygen supply as well as transcutaneous pacing, but eventually the patient will need a permanent pacemaker. Atrial pacing can also be done because it prevents episodes of atrial fibrillation. However, it does not affect prognosis, therefore not indicated in asymptomatic patients. So this is the end of the lecture. I hope you learned something from it. If you do, please like my video and share it with your friends. Subscribe to my YouTube channel, and thank you so much for watching.